Hello and welcome to my channel. In this lecture we'll be discussing the back of thigh, so let's begin. The back of thigh occupied by the hamstring muscles that pass hip and the knee, so they will act on the hip and act as well on the knee. On the hip it will be extension, on the knee will be flexion. The first muscle of the hamstrings is the biceps femoris. It has a long and short heads. See, this is the biceps femoris. It has a long head and a short head. The long head arises from the inframedial area. Remember the upper quadrangular part of the ischial tuberosity we talked about? It's divided by a line from medial to lateral to a superolateral region and inframedial region. Well, the long head of biceps arises from the inframedial region, common with the semitendinosus muscle. Okay? It descends and crosses the sciatic nerve, as you can see here, from medial to lateral. And after crossing, it receives the short head on its anterior aspect. It's coming from the lateral lip of the linea aspera and the lateral supracondylar ridge and the lateral intermuscular septum. Both heads unite and form a tendon that inserts by splitting around the fibular ligament and inserts in the head of the fibula and lateral tibial condyle. So it does not, it's not in the styloid process of the head. The styloid process of the head is attached to the lateral ligament or the fibular collateral ligament, but the biceps splits around the ligament and attaches to the head of the fibula and the tibial condyle. The nerve supply of the long head by the tibial nerve and the short head by the common peroneal nerve. So both are the sciatic, but you must mention the components. The long head by the tibial nerve and the short head by the common peroneal nerve, which lies along the tendon of the biceps femoris muscle. Okay, the semitendinosus muscle, this is the semitendinosus muscle, arises in common origin with the biceps femoris from the infralateral aspect of the upper quadrangular area of the ischial tuberosity. And at mid-thigh, it transforms into a round ligament lying on the semimembranosus muscle. As you can see here, this is the semitendinosus. Beneath it is the semimembranosus muscle. Inserts in common tendon. Remember the SGS, sartorius gracilis semitendinosus. In the common tendon with the sartorius and gracilis, it's the posterior to them on the upper medial surface of the tibia, so it passes the knee joint. Nerve supply, tibial nerve of the sciatic nerve. This is the semitendinosus muscle. The semimembranosus muscle, this muscle, arises from the superolateral area of the quadrangular area of the ischial tuberosity and anterior to the semitendinosus and biceps femoris. This inserts in the groove for semimembranosus beneath the medial condyle of the tibia on the back posteriorly, but sends multiple extensions to the inferior lip of the groove of the semimembranosus muscle, behind the medial ligament of the knee, sends the oblique ligament. This is the oblique ligament, which is an extension of the semimembranosus muscle. Oblique ligament to the lateral femoral condyle. It supports the back of the knee. And the semitendinosus lies on the muscle posteriorly. The nerve supply is by the tibial nerve of the sciatic. Now, the action of the hamstrings, they extend the hip and flex the knee. The biceps also lateral rotate the tibia. The semi-muscles medial rotate the tibia. And whenever the center of gravity is anterior to the hip axis, the hamstrings kick in and take action. They are the active muscles in walking and in extension, for the main extensors of the hip, actually. Recall the difference between main extensors and powerful extensors. The most powerful extensor is the gluteus maximus, but it's not the main extensor of the hip. The popliteal fossa, you can get a specimen like this in the exam and ask to identify which knee is this, right or left. It's easy. Look at the tendon that accompanies a nerve, see? This must be the lateral side because this is the biceps tendon and this is the common peroneal nerve along the tendon. This is the lateral side, this is the medial side, so this is the right knee. It's a diamond-shaped area, superolateral by the biceps femoris muscle, superomedial by the semi-muscles, the semitendinosus and semimembranosus, infralateral by the lateral head of gastrocnemius and the plantaris muscle, inframedial by the medial head of the gastrocnemius, the floor by the popliteus muscle and its fascia on the back of the knee joint, and the roof is skin and fascia, popliteal fat, and branches of the posterior femoral cutaneous nerve. Okay, the contents of the fossa. The tibial nerve crosses the vessels from lateral to medial as it descends. As you can see here, it's will cross from lateral to medial. The common peroneal nerve along the tendon of the biceps. The popliteal vein, see the popliteal vein formed by the anterior and posterior tibial veins. It's anterior to the tibial nerve and posterolateral to the popliteal artery. So the popliteal artery is the deepest structure or the most anterior structure on the back of the knee with its articular branches, with the articular branch of the obturator nerve accompanying the artery, and lymph nodes around the vessels, the popliteal lymph nodes. The popliteal artery, it's a continuation of the femoral artery from the aperture in the adductor magnus, the adductor opening. It descends obliquely and divides level with the lower border of the popliteus muscle into anterior tibial and posterior tibial. The anterior tibial that makes the kink to the anterior side of the leg, and this is how you identify the artery in X-ray, in arteriogram. The artery that makes the kink is the anterior tibial artery. Branches of the popliteal artery gives cutaneous muscular branches. Pay attention to the muscular branches to the heads of gastrocnemius, the sural arteries, because obliteration of these vessels will result in avascular necrosis of the heads of the gastrocnemius. Okay? Gives also the soleus muscle, the muscular branches, and gives the genicular branches. The lateral superior or superior lateral genicular deep to the biceps femoris muscle and the head of gastrocnemius, proximal to head of gastrocnemius. You can see here, this is the lateral genicular superior artery. The medial superior genicular is deep to the semimembranosus muscle and proximal to the head of gastrocnemius, and enters the adductor's opening opposite the course of the popliteal. The lateral inferior genicular artery deep to the head of gastrocnemius, biceps and fibular ligament of the knee. See that? The medial inferior gastrocnemius along the upper border of the popliteus muscle, as you can see here, of the popliteus muscle, and runs deep to the tibial ligament or the medial collateral, or the tibial collateral ligament or the medial ligament of the knee. Middle genicular that pierces the oblique ligament on the back of the capsule of the knee and enters to supply the cruciate ligaments and the synovial membrane. So these are 5 genicular arteries. They are accompanied by nerves, the upper lateral, the right lateral, the lateral superior and lateral inferior by branches from common peroneal, and superior medial and inferior medial and middle by branches of the tibial nerve to supply the knee joint. Anastomosis around the knee joint, genicular anastomosis formed by the genicular arteries we have just described. The descending genicular artery from the femoral, descending genicular artery. The fibular artery or circumflex fibular artery, the anterior and posterior tibial collaterals or recurrence arteries, anterior and posterior recurrent tibial arteries. Okay, all these share in the anastomosis around the knee, so that if one is occluded, the others will take over, like in flexing of the knee, for example. The popliteal vein is formed by the union of the comitatus of the anterior and posterior tibial arteries. The anterior and posterior tibial veins, they form the popliteal vein, and the popliteal vein receives the small saphenous vein in the popliteal fossa, the small saphenous coming from the lateral side of the foot and ascends in the middle of the back of the leg on the gastrocnemius posteriorly. The popliteal lymph nodes around the popliteal vessels and enlarges in lesions in the heel, because they drain the first stop or station for the heel lymph is in the popliteal lymph nodes. As you can see here, these are the lymph nodes that are scattered around the vessels. The nerves, we have the posterior femoral cutaneous nerve. This is the posterior femoral cutaneous nerve covering the roof of the popliteus fossa and descending to half of the leg. The posterior femoral cutaneous nerve emerges from the greater sciatic foramen below the piriformis muscle, medial or posterior to the sciatic nerve. Okay, descends covered by the fasciolata, then pierces the fasciolata proximal to the knee or above the knee, then descends with the small saphenous vein till the mid-calf area where it ends its supply, and gives gluteal branches, peroneal branches. Remember, we discussed these in the perineum and the back of the thigh and leg. The sciatic nerve, you see this thick nerve, this is the sciatic nerve. Sometimes it comes out divided into common peroneal and tibial components, and then the common peroneal commonly pierces the piriformis. You will see it coming out of the piriformis. But in this plate, it's the tibial and common peroneal components are stacked together till the middle of the thigh. Above the knee, they split. It's 2 centimeters wide and descends midway between the ischial tuberosity and the greater trochanter, pass posterior to the gemelli obturator internus and the quadratus femoris muscles, inferior gluteal vessels medial to it, and behind, they are both behind the adductor magnus, covered and crossed by the long head of biceps, as we discussed earlier, and divides into tibial and common peroneal proximal to knee. Now, there's a condition called sciatica, inflammation of the sciatic nerve, or pressure on the roots of the sciatic nerve by a retroverted, retroflexed uterus, for example, which gives pain shooting in the back of the thigh till the middle leg. This is along the course of the sciatic nerve. And also be careful in intramuscular injections, as we discussed in the gluteal region, that you divide this to 4 quarters and give it in the upper lateral quadrant of the gluteal region to avoid injury of the greater sciatic nerve and the surrounding structures. The tibial nerve in the thigh, it crosses posterior to popliteal vessels from lateral to medial, as we discussed earlier, and passes anterior to the soleal arch because of the origin of the soleus muscle on the back of the leg, passes anterior to the soleal arch, overlapped by the junction of the heads of the gastrocnemius. Now, branches of the tibial, articular branches with superior, middle, and inferior middle and middle genicular arteries. Okay, so they're taking the left three branches, the other two branches from the common peroneal, the superior lateral and inferior lateral. The muscular branches to long head of biceps, semitendinosus, semimembranosus, the ischial head of adductor magnus, gastrocnemius, soleus, and popliteal muscles. The sural nerve descends, on the back of the leg and to the lateral side of the foot, and it's joined by a sural communicating from the common peroneal nerve. It's a cutaneous branch. Okay, the common peroneal nerve, the L4-5 S1-2 dorsal divisions, descends along the tendon of the biceps. See that? It's along the tendon of the biceps, curves around the neck of fibula where it's liable to injury in fractures neck of fibula. Take care of that because it produces, the talipus equinovarus. The talipus equinovarus, drop foot injury because of the cut of the common peroneal nerve. There will be no more superficial and deep peroneal nerves for the extensors of the foot. Divides underneath the peroneus longus into superficial and deep peroneal branches. Branches in the thigh, it gives the short head of biceps, as we mentioned before. It gives the sural communicating with the sural of tibial, and it gives the lateral cutaneous nerve of calf to supply cutaneous innervations to the lateral side of the leg, and gives the superior and inferior lateral genicular branches. So these are the branches of the common peroneal nerve. Now, by covering the common peroneal nerve, we covered the posterior aspect of the thigh. I hope you got the maximum benefit from this lecture, and thank you very much for watching.